back to the Ken Show. You want to get the most from your workout? Well, then you need your heart, your lungs, your muscles to be in tip-top shape. And we have expert advice here today. Please welcome from the Rothman Institute's Performance Lab in Cherry Hill, Dr. Michael Ross. Thanks, Michael. Along with Brett Trumbauer, who is all geared up and ready to be tested.
That's right. This is exactly what our testing equipment looks like. It's designed to measure how the heart, the lungs, and the muscles all work together when you exercise.
And so what exactly do you have him hooked up to?
Well, there's a flow sensor here, a carbon dioxide sensor, an oxygen sensor. He's got a heart rate strap on, so we can follow all these variables while we put him through an exercise
And
test.
it looks like it's wireless. Could you actually take this on the road and do real-world testing?
We can do real-world testing, but more importantly, for people who are soccer players or field hockey players, we can hook them up and figure out what's hindering them from reaching their top form.
Is this only available for top athletes, or can anyone come in to be tested?
It's really, I test anybody. And I test anybody who's having trouble with exercise. And that could be from a heart standpoint, a lung standpoint, or even an overuse injury thing that sometimes is from muscle fatigue because of a heart or lung problem. So we can look at all those variables.
What are some of the most common complaints you hear from somebody that's coming in to be tested?
I see a lot of shortness of breath from people. Also people who feel like they're running out of energy for longer rides. If you're doing the Livestrong 5K, you know, we could make you faster for that. So really, it's anybody who wants to get in better shape or get back up to a level playing field.
And sometimes you hear people say, before taking on this exercise, you should check with your doctor. Are they talking about you?
They could be. They could very well be.
All right, Brett's ready to go. What are we going to have him do?
Well, he's just going to pedal. And so what, you know, the antenna up here from all this equipment gets transmitted to a base station. And on that base station, I can follow his heart, his lungs, and see where he's reaching his maximum. And it may not be that he's reached a maximum anywhere else except his lungs, and his heart and muscles could still be doing fine, or vice versa.
Now,
and so once we find that, we can treat it.
If you're a cyclist, you come in and work the bicycle, correct?
Correct.
What if you're a runner? Same story?
Same story, except on a treadmill. I have an ergometer there. We're housed in Velocity Sports Performance, which has a track, a rubberized track, so we could test track workouts. I also have some turf there. We could put people through a sport-specific obstacle course.
This technology has come a long way, hasn't it?
Oh, absolutely. I mean, it used to be that it wasn't portable or wireless like this, and you'd have to be hooked up to a tube and all sorts of leads, and you could only be this far from the computer. But now we can really take it anywhere. I have a kilometer range.
He's pedaling pretty slowly. Can he breathe okay? Are you sure you're okay, Brett?
I'm good. The resistance is getting harder and harder as he's going, because that's controlled, so we know exactly at what workload you're also fatiguing.
And so are you going to test each athlete to see when they fatigue?
Well, we don't just look for fatigue. We look for anything that's causing a problem. And so we start at very easy workloads, and the workload increases throughout the course of the test. We check lung function before, we check lung function after, and we even follow and monitor the heart and the lungs during. So it's pretty comprehensive.
And once you have those test results, what's the next step?
Well, then we can prescribe workouts. We can treat underlying medical problems like asthma, which a lot of athletes don't even realize that they have.
How common is that to have something that is more serious and not realize it until you're actively working out?
Well, the more serious stuff is less common, but there's certainly a lot of things out there that limit people's potential, and that's the stuff that I'm looking for, and we can treat them and make them exercise better, play their sport better, and just be happier overall.
So what do you need to know if you're an athlete or somebody that just wants to exercise and do it in a healthful manner before you contact the Rothman Institute?
You know, I'll see anybody who has any exercise concerns, whether it's a musculoskeletal problem or a heart and lung problem, and if you feel like something's holding you back, that's what I'm looking for.
Dr. Michael Ross, thank you so much.
My pleasure.
Brett, thank you so much for getting geared up. Good job.